beloved medic team came to the streets in a place that most in our city know as the pit of despair. Yesterday, we turned it into a pit of hope and healing, offering our second annual spring Help on the Streets health fair. We offered blood pressure checks, blood sugar checks, healthy food, frowns, medicine on hand with our herbalists, pet medics who offered healing salves they had made to pets, first aid supply giveaways, and even live music, Zumba, and yoga. It was a time to share with each other, to educate ourselves, and to care for one another. Our street medic team emerged out of the death of one of our homeless friends, Janet Jones, who froze to death on the streets. We began to ask the question, what can we do? Folks on the streets like John said, we want to learn how to take care of each other. And so folks like May and Todd and Angel and James, Jesse, Elvia, and many others began to sit in a circle and train with registered nurses, EMTs, and herbalists to take care of folks on the streets, to begin offering prevention health fairs, to do outreach, and to share their experience and hope with one another. One of our registered nurse trainers wrote this reflection about yesterday. Beloved is engaged in groundbreaking work, training homeless and formerly homeless folks to do health assessments and respond appropriately to emergency situations. As Amy says, we are learning to be the people we've been waiting for. Watching these medics care for their community this afternoon was incredible. I am grateful for the opportunity to share a little of the knowledge I have with them, to learn from them every week. Housing is the most basic form of health care we have. And unfortunately, in Asheville, hundreds of people, both adults, elders, and children, live without homes and face incredibly poor health outcomes. Today, the medics were able to address some of these poor health outcomes, offer basic care, and educate, because knowledge about our bodies is key to the better relationship we have with ourselves. I love the work I do in the hospital walls, but I never feel more engaged than I do when I'm with these street medics doing this work outside the walls to care for the most vulnerable. At the heart of what we are doing is addressing the lack of connection that exists in our country. 1 in 4 Americans say they have no one to confide in. Research shows that a lack of meaningful connection is more detrimental to our health than smoking, obesity, and hypertension. Strong connections lower anxiety and depression, boost our immune system, lengthen our lives. While today was about wellness screenings and education, it was also about connection. There are people in this community who care so deeply about the most vulnerable among us. Connection breeds resilience, and these medics were sowing the seeds today. If you'd like to learn more about our street medic work, reach out to us at Beloved Asheville and be a part of the change that we wish to see.